It's 11 a.m. here in Seoul. I'm Oh Seong at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation available in English. We're going to go into the briefing room where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So we're just about to do that. We're going to be showing you the briefing room at Sejong Government Complex, and there is Director General Yoon Tae-ho standing at the podium.
Sign language translation available. The briefing will be given by Mr. Yoon Tae-ho, the Chief of Quarantine Supervision Department, and it will be followed by a Q&A session. So here's Mr. Yoon Tae-ho. Let us now begin our regular briefing for March 20th, Friday. As of today, midnight, we have a total of 6,325 who are in quarantine, and of them, 2,233 have been discharged following full recovery. 94 fatalities have been witnessed so far, and we have a total of 8,622 52 confirmed cases, up 87 from yesterday. I extend my deepest condolences to those who have died as well as their bereaved families. Prime Minister Chung Se-kyun convened a KCDC meeting this morning where he touched upon issues including special entry procedures as well as economic benefits to relieve the tax burdens. And he also said that we need to exert our utmost efforts to mobilize all necessary personnel and logistics so that the expanded special entry procedures could be implemented in full-fledged. And he also urged related ministries to help alleviate any tax burdens that people could face. And with the global outbreak of the coronavirus globally, we have implemented the special entry procedures as of March 16th on all arrivals from Europe. And this has been expanded to include all of the arrivals from all over the world. And from the midnight of 20th, we have implemented more stricter special entry procedures and a screening process. And in this process, they need to submit a health document, and which will help us to identify those with symptoms and those without symptoms. And if you have symptoms, they need to be sent out to a special facility where they will be monitored for the next 14 days. And of those who have been tested positive, they would also be treated at hospitals as well as designated live treatment centers until they are fully recovered. And if they are tested negative, they still need to go through self-quarantine at their specific residences. And for them, we will carry out telephone consultations on their health conditions on a daily basis. So about 60% of those who came back to Korea from Europe were for long-term residents, and others were regarding the businesses and other short-term visits. And of them, 90% were Korean nationals and 10% were foreigners. And these more stricter special entry procedures will be implemented as of the 20th, together with the help of related ministries. And among the widespread of coronavirus in Europe, we need to acknowledge the fact that the confirmed cases is surging in this area. And the government is trying to curb the further influx of imported cases. And we will also, when necessary, implement stricter quarantine measures. For all of the people who are arriving to Korea from other parts of the world, excluding Europe, we advise you to stay at home and refrain from going outdoors. And please monitor your conditions and download the self-diagnose application and report your health conditions to us on a daily basis for the next 14 days. The KCDC also implemented and opened an English website to help and to accommodate to the needs of foreigners. And we will also open this website in Chinese as well. This website will provide information on any related information that are needed, including those of the life treatment centers and public relief hospitals. Moreover, the briefing will also carried out with simultaneous English interpretation, and this is carried out twice a day, 11 a.m. and 2 p.m. So please watch our briefing via online. And we need to also strengthen our quarantine measures for nursing homes and nursing hospitals, because most of the people who are staying there have chronic illnesses and they are very old. They have a higher risk of vulnerability of serious symptoms. And currently, as for the nursing homes and nursing hospitals, we are prohibiting any unnecessary medical visits by others. And if someone has to make an essential visit, they are all advised to wear protective face masks. And we also carry out on a daily basis thermal screening on all of the staff and care providers who are working at the nursing homes. Up until now, we carried out a 3-stage monitoring system on all of the nursing homes, and we also carried out enumeration investigations on these nursing homes. However, we are still witnessing sporadic outbreak of among the nursing hospitals, so we need to intensify our quarantine measures even further. In order to really curb the spread of the disease, we need to provide more instructions and orders that need to be complied with in order to curb the disease, and we will also have penalties if these are not abided by. We will also designate a specific personnel who will be in charge of all of the visitors to the nursing homes, and at the nursing homes they need to also report to us on a daily basis the thermal screenings of all of the people, not only the users but also the caregivers and the visitors to the facilities. And whenever they meet with the patients, the workers who are working at the nursing hospitals need to wear face masks and they need to wash their hands on a regular basis. And if these orders are not abided by, we will also we will be considering to implement any penalties for these nursing homes. And I would like to thank all of those who are helping us to curb the further spread of the virus. And we all once again highlight that abiding by such procedures is very important for all of the institutions, facilities. And this is the following about the updates on the taxation benefits for fighting against coronavirus. We will be expanding and postponing the deadline for tax payments, and these will be delayed. And the taxation office is trying to mull over any possible areas for to help relieve the taxation burdens. And for the Daegu and other regions that have been designated as special disaster zones, this tax payment will be delayed by 1 month. And many other proactive measures are currently being mulled over so that we can alleviate any of the immediate tax burdens that the people might face. And regarding the fact that we are witnessing a sporadic outbreak here in Korea, as well as a widespread surge around the world, the confirmed cases in Korea could seem smaller compared to those of other countries, but we would like to highlight that we cannot put our guards down as of yet, because we are seeing repeated outbreaks on a sporadic basis here in the country. And we believe that we will witness in the going future the continued and prolonged outbreak of the coronavirus, and we need to take measures to mitigate any of the damages that the virus could have on us. Especially, the coronavirus has a very fast contagion, and therefore, many countries around the world are having difficulties as they combat the virus. Therefore, we need to highlight the importance of identifying the patients at an early stage, and fighting against coronavirus is impossible without the help of the rest of the public. Washing of your hands thoroughly and coughing etiquettes, as well as keeping social distancing, is very important. These measures need to be put in place for a prolonged period of time, and we need to heighten our personal sanitary practices. Especially for those of you who are sick, please do stay home instead of going to workplaces and going outdoors. Take a rest for the next 3 to 4 days and monitor your conditions. And we need to respect such decision going forward. As we enter the weekend, the weather is getting nice, and many people are having difficulties just having to stay at home. But just as you have been participating in the social distancing measures up until now, we hope that this measures could be prolonged in the going future as well. Thank you for your cooperation. And we have been seeing high clusters and infections within a closed-door space. And especially, I would like to advise all of the religious activities to be canceled in the near future. However, we also ask for your continued participation in all religious circles around the country. Thank you very much.
That was a live briefing from the South Korean health authorities on the current coronavirus outbreak here in Korea. We just heard that there were 87 additional infection cases here in the country, bringing the total to 8,652. There were also 3 more deaths, bringing the total death toll to 94. And the official just reminded us that even though the weather's nice, we need to stay indoors and maintain social distancing. Well, that concludes our coverage of this morning's briefing. We'll be back in just a little while at 12 p.m. with our regular news. Bye for now.